Welcome to this microlecture on skin cancer. In this brief session, we'll discuss the three major types of skin cancer, how to identify them, and some key prevention strategies. Skin cancer occurs when abnormal skin cells grow uncontrollably, also known as proliferation of the cells. The primary cause, or etiology, is exposure to UV rays, or ultraviolet radiation, commonly from sunlight or tanning beds. There are three major types of skin cancer: basal cell carcinoma, or BCC, squamous cell carcinoma, or SCC, or malignant melanoma, sometimes written in medical notes as MM. Basal cell carcinoma, or BCC, is the most common type of skin cancer. It usually grows slowly and rarely spreads to other parts of the body. It often appears as a shiny, pearly bump on sun-exposed areas like the face or neck. Risk factors for BCC include prolonged exposure to UV rays, like sunlight or tanning beds, or a history of frequent sunburn. Treatment for BCC includes surgical removal or topical therapies. As it is less aggressive, there are options to have topical therapy. Squamous cell carcinoma, or SCC, is the second most common type of skin cancer. Unlike BCC, it can spread to deeper layers of the skin and metastasize if left untreated. SCC often appears as a red, scaly patch or a sore that doesn't heal, commonly on sun-exposed areas such as the lips, ears, the scalp, hands, and arms. Immunosuppression and chronic wounds are significant risk factors for SCC. Treatment usually involves surgical excision, and in some cases, radiation therapy is used. Melanoma is the most aggressive form of skin cancer. It can develop from an existing mole or appear as a new, dark, irregular patch. Melanoma often spreads quickly to other organs, making early detection critical. Common risk factors include a family history of melanoma and severe sunburns, particularly during childhood. Treatment usually involves surgical removal, and more advanced cases may require immunotherapy or targeted treatments. But the most common would be to excise the entire area of pigment that is involved in the melanoma. For early detection of melanoma, it's vital to observe these spots, and medical professionals use the ABCDE rule in order to do so. A stands for asymmetry. This is an example of an asymmetric mole. It means that one half of the mole might look different from the other. B refers to border. As you can see in this image, there is an irregular or poorly defined border in this mole. C stands for color. If you see multiple shades or unusual pigmentation developing in a mole, it's definitely something to get checked by a medical professional, as that is a common feature of melanoma. D stands for diameter, where moles larger than 6 millimeters, about the size of a pencil eraser, might be concerning. And E is for evolving, meaning there's a noticeable change in size, shape, or color over time, and that should be examined by a healthcare professional. It really helps to monitor the moles that you have on your body in order to prevent melanoma. Prevention is key when it comes to skin cancer. To protect yourself, use a broad spectrum SPF, at least 30, and reapply regularly. Wear protective clothing, wide-brimmed hats, long-sleeve shirts when in the sun, and avoid being in direct sun exposure when you do not have this protective clothing. Regular skin checks, both self-exams and exams by your dermatologist, are essential for catching skin cancers. And of course, we want to avoid tanning beds and prolonged sun exposure. In conclusion, skin cancer is highly treatable if caught early. As healthcare professionals, it's crucial to educate patients on recognizing the signs and practicing sun safety. Thank you for watching.